So the operation went pretty well. I've heard that, and that's excellent. But I understand there was a setback actually shortly after you came home. What happened at that period?
Yes, it was about 3 months after, and I was just getting on my feet, walking, trying to get, not doing full exercise, but walking. My daughter came, she lives in South Africa. She came home, and it was a nice family time. And then I started getting quite constipated and a bit of stomach pain. I didn't think anything of it. And after about 4 or 5 days, I started vomiting quite badly. So my husband phoned the hospital and they said, bring her in. And it wasn't like normal vomit, it was quite dark. And so I came back in, and then I had a temperature and I was just getting worse, and they were saying, we don't really want to open you up again, do surgery. So then it was waiting to go to the loo again.
Conservative management, they call
Yeah.
it. Basically resting the bowel,
Yeah.
rehydrating you, and hoping that it's all going to be okay.
Yes, which after a while they realised this wasn't going to happen. But due to the temperature, they said I had sepsis. So they said, we're going to operate. But it's quite a tricky operation, and I have to be honest with you, you might not survive the operation. So I'm wheeled down again to the operating theatre, and I recognised everybody.
Really?
That was the awful thing, where they're like, you look so familiar, and I was laughing. I said, it's me again, do a neat job. Because I thought the scar's got to be opened again, so I'm like, please do a neat job. And anyway, that all happened. Apparently an adhesion, you get adhesions from surgery, and this had blocked.
That was about to ask.
I was just unfortunate, this had blocked the bowel completely, so no matter what they did, I would never have opened my bowels because it was blocked. But that was, I woke up in intensive care, and I have to be honest, it was amazing. I know that sounds a bit strange.
In what sense?
I just felt, it's the most relaxed I'd felt in the whole of my life. Everything was done for me. I just laid there. And I've never felt so relaxed. Okay. Whether it was the drugs they were giving me.
It could be.
And I had a fabulous nurse, and we had a bit of a laugh. She said, I'm going to make sure I stay with you, because we used to have a bit of a joke, if you can make jokes about illness. But anyway, we did. We had a laugh. And I was in there for about 3 days. And then moved to, it used to be the old burns unit, but it was like a semicircle. We all had our own rooms, because by then my immunity had just gone.
Yes.
So I was in there, and slowly, I was in hospital this time for about 2 weeks, which I wasn't very happy with. But then the poor old bowels were a bit iffy then. I had terrible diarrhea. They gave me a commode next to the bed, which wasn't, but after a while, you know what I mean, it goes out the window. I'm alive and it's all sorted, that's all. So that was, and then eventually the doctors was like, you know, try and eat a bit, try and do this, and I did. Soup and cereal, managed a bit of cereal. And then after 2 weeks, I was let home, and touch wood, everything's been fine since then.
Now, how long ago was that you finally came home?
That was last June. Yes. Around about the middle of June.
Okay. And since then, have you had any other major complications, or has it been
everything's been fine. Yeah, everything's been fine since then.